And here is your question. Right, so if you have read and understood, considering a history-taking session, kindly begin.
My name is Dr. Howard. I am a surgical candidate. May I ask your name and age, please?
Yes, I'm Linda. I'm 35 years old.
Today, I want to ask you some question is regarding your problem. Is it okay?
Okay.
How can I help you today?
Oh, doctor, I'm having this severe tummy pain. Please help me out.
Tell me, when did you notice this pain?
Yeah, it's just since one day.
One day. What is the intensity of this pain? If you say that 1 is the least and 10 is the highest mark, what is the severity?
It's around 8.
8. Is it radiating to anywhere else?
Sorry?
Is it radiating, going anywhere else?
It's going to my back of the tummy.
Yeah. Is the onset was sudden or gradual?
Yeah, it's suddenly.
What is the character of this pain? It is dull, aching, stabbing, gripping.
Yeah, it's gripping type of pain, severe pain in nature. Severe pain.
Severe.
Yeah.
And then tell me, is this pain relief? What are the elevating or aggravating factor of this pain? I mean, how it is relief or how is it aggravated?
Yeah, when I take some painkillers, then it got some relief. But whenever I take meal, it gets aggravated. And when I get a position of leaning forward, it gets relieved somewhat.
Yes. Okay. Do you have the at which time of day it is more severe?
There's no such variations during the day. It's there since yesterday. It's continuous.
Is there any previous episodes of this pain?
Yeah, I had this type of pain several years ago. Now I'm having this
7
again.
years, but one episode.
Yes, yes.
Okay, but not the continuous. Okay.
No.
Okay. Do you have any? Tell me. Is this pain radiating to your shoulder?
No, just to my back.
Do you have vomiting?
Yes, I vomited for 2 times.
Blood is there?
No.
Is this pain increased by fatty meal?
Yes, whenever I take some meal, this pain increases.
Do you have chest pain?
No, doctor.
Breathlessness?
No, doctor.
Do you have blood in stool?
No, doctor.
Do you have acids feeling in the throat?
No, doctor, but I feel some bloating in my tummy. No acid feeling.
Okay. Please tell me that do you have any previous past medical history or surgical history? No?
No, I don't have any past medical history, or there's no
Surgical
such, no.
Any medication are you taking?
Yeah, I took morphine for this pain.
Okay. And allergy to any medication?
No, doctor.
Okay. And may I ask some personal question to you?
Yes, please.
To whom are you living with?
Yeah, I'm with my partner and my children.
What is your occupation?
I'm a school teacher.
Okay. And are you smoker or drinker? You have told me
Yeah,
that
I
you are
drink.
taking alcohol. Yes.
Yeah.
You are taking alcohol. And are you smoker?
No, doctor.
How many pints you take alcohol of alcohol? Units,
Yeah,
units.
I take usually half bottle of vodka per day.
Okay. Any family member, how many stairs you can manage to, how many stairs you can use?
Like what? How
Okay,
many stairs?
leave it.
Okay.
How
Can you
many
tell me
units?
units? No, units. Can you tell me the units?
Units of what?
Vodka, half bottle.
It's
You have
around,
told me the half bottle,
yeah,
half bottle.
half bottle. Yeah.
Uh, Please tell any family member with the similar problem.
No, doctor.
What is your idea about the problem?
Yeah, I think I'm having this tummy pain due to my consumption of alcohol. Do you think so?
And maybe what is your concern with us?
Yeah,
Concern with the
please.
problem?
Yeah, I don't. I hope you get some idea what's causing this pain.
And what are your expectation with us?
Please relieve my pain.
Okay. Do you have any breathlessness?
No, doctor.
Do you have
Okay, can
any
you please
short of breathness?
summarize your history now, please?
Yes. This 34-year-old lady has a sudden onset pain for one day, and it is radiating to the back. It is sudden and gripping in nature, and it is relieved by painkillers and by leaning forward, and aggravated by food. She also has vomiting, especially for pain is also aggravated by fatty meal and bloating. She took morphine drug for this pain relief, and
And it's a
alcoholic
known
half
case
bottle.
of, yeah.
Yes,
It's
she's a
alcoholic, a known case of alcoholic and diabetic, known
diabetic. Yes, non-diabetic. Yes.
Okay, so what are your provisional and differential diagnosis?
My provisional diagnosis is acute pancreatitis. Other are the acute cholecystitis, perforated peptic ulcer, mesenteric ischemia, and myocardial infarction.
Okay, how do you plan to manage your patient? What are the investigations you'll ask for?
Yes, after taking history examination, I will do the full blood count, serum amylase, LFT, urea creatinine, electrolyte, C-reactive protein. Then I will do the X-ray chest erect view, and I will do the ultrasound abdomen. And if I have a doubt, an ECG is must to rule out cardiac problem, and troponin level. And then I will do if I have doubt, then I will do the CT scan abdomen.
What are the treatment alternatives that you can offer this patient?
This patient, I will check the severity. For example, I will do all the tests which are needed for Ranson criteria, Glasgow criteria, serum calcium, and LDH, AST, all the tests and nitrous fluid sequestration. Then I will keep the patient according to this criteria. Either it is mild, moderate, or severe. Then if it is mild, then I will give IV fluids and analgesia, intake output charting. And if it is severe, then I will manage her in the intensive treatment unit, and I will give IV fluid. Prophylactic antibiotics can be given, and analgesia will be given, oxygen should be given. And I will also give nasogastric feeding will be administered. And I will check the coagulation profile, And if a patient has some stone, can do the MRCP, magnetic resonance pancreatography, that if there is, what is the cause of this problem, and then I will go accordingly. Care
Okay,
of
the
critically ill-
most important cause of this problem you have missed. Patient
Alcohol,
takes,
diabetes and alcohol,
yes,
morphine
but yes.
and morphine.
So you have to help her by arranging a treatment for her addiction. One, addiction of vodka, second, addiction of dependency of morphine. So you have to manage a counselor or psychologist for her,
Yes.
and then you have to treat her diabetes as well. This was the most important, which you forgot
Yes.
to mention. Yes.
Yes, yes, it is very important,
Yes.
because there are two, three factors that are responsible for our current problem.
For her condition. And one of my concerns, your primary provisional diagnosis was wrong, because since they are mentioning in the stem that patient is a known case or has the habit of drinking, so it cannot be the first acute pancreatitis. It is rather chronic pancreatitis. Patient has had previous attempts of pancreatitis as well, which she may not have been aware of. So
Yes, it is
yes.
confusing, madam, because
This is
the
my
patient
stem.
told me,
Yeah, but I
patient
tried
told
my
me
best.
one day, and
Yes.
then when, because you are right that my diagnosis is going to edit, but he told me that only one day and only 7 years back.
Yes, but
He
for
gave me the
7 years they are drinking.
one
you know.
episode only.
Yeah, but patient, maybe this was the most tragic or most severe episode which patient has had. Otherwise, patient has had previous episodes as well. So basically, diagnosis is chronic pancreatitis, and this also
Yeah,
you
doctor.
needs to manage. Yes.
Yes.
When I told that I had these episodes previously, that means I had the acute pancreatitis previously. That's why I was taking morphine for
Yeah.
this pain, and I was controlled by this morphine. The pain was controlled. Now, since one day, I'm having this pain again.
Yeah.
So
Okay,
that
maybe I
means the
didn't listen. You are right.
That's
morphine dose is not adequate, so we should step up the analgesic.
Yes.
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 And yes, please continue.
And regarding this history taking, if I may say something,
Yes, please.
you the first thing is, when I said I'm having severe pain, you could have asked me if I need any
I'm sorry.
analgesic.
Yeah. Yeah.
Yes. Yes. You are right. Yes, you are right.
And when I said I had tummy pain, severe tummy pain, you could have asked that where is the pain, site of the pain.
Yes.
Yes.
And
Yes, you are right.
using the word aggravating, and how is it? Okay, radiate. Okay, does it go anywhere? Maybe you could have used another simple word, because aggravating, does it make, how it makes, or what makes it worse? Instead of using the word aggravating, maybe, yeah, it's English, so they can maybe understand, but it's more kind of our language rather than layman.
It means, madam, whole stem is wrong. All the questions are wrong.
No, questions were right. You were trying to rule out, but provisional diagnosis. Okay, if that is wrong, then they don't accept everything. And besides, your expressions were not there. His whole history taking, the purpose is that you are showing empathy to the patient without being sympathetic. So you have to show empathy,
Yes.
like, I'm really sorry. Would that be all right for me to continue, or do you want analgesic? Do you want me to stop? Or like, you have to show these sort of gestures, or these sort of remarks you have to pass. We'll
Yes.
practice. Doesn't matter. We'll
Yes.
practice. Thank you.
Okay.